How did I invent the Ribella procedure? We developed this invention based on the pectus patients who have been coming to me for years. What is pectus? Let's address that first. Pectus means chest cage in Latin. In other words, the structure that surrounds our ribs and the breastbone at the front, which forms these important organs, as well as the structure that encases the ribs and other internal organs, is called the chest cage. This is called pectus. If this is sunken inward, it is called pectus excavatum or funnel chest. If it protrudes outward, it is called pigeon chest or pectus carinatum in medical literature. I have been treating these chest wall deformities for years. Rib fractures, rib tumors, in other words, the chest wall, is actually my particular area of interest. When we talk about thoracic surgery, there are two main areas, dealing with the lungs and organs inside like the thymus and diaphragm, and dealing with the chest wall. My particular area of interest is the chest wall, and while working in this field, I used to remove the ribs of some individuals due to a deformity called rib flare, that is protruding rib deformity. Which parts was I removing? I was removing the cartilaginous ribs, you see here. For years, I had been dealing with these cases, and one day I wrote a blog post on my website. I wrote about the details of rib removal, and after that, I started receiving requests one after another asking if I could remove their ribs. So I asked whether they had rib flare deformity or any other condition that might require rib removal. Because as thoracic surgeons, we are doctors who focus on health rather than aesthetics. There needs to be a medical reason. There has to be either a tumor or a deformity for us to be able to remove it. They said, no, it's neither of those. So what was their issue? You see those two floating ribs at the end? They said they wanted these floating ribs removed so they could have a slimmer waistline. And so I started thinking about how I could make that possible. If I remove those ribs, I would be acting against their intended purpose in creation. As I just said, we are health-focused, not aesthetic-focused. Why would it be acting against their purpose? What is the reason these were created? In the event of an accident or trauma, their purpose is to protect our vital internal organs from impacts. So if I remove those lower ribs, organs like the liver, kidneys, and spleen would be put at risk. And let's say I did remove them. If a few months later the patient gets into a car accident and suffers a liver injury because of this, I would feel bad. Thinking about this, I said I wouldn't remove them. But 1, 2, 3, 4, exactly 5 requests came in within 40 days. And all of these were patients who came from abroad as part of health tourism. And I started thinking about how I could satisfy these patients coming from abroad. While considering this, I began to wonder if, by making a small incision and changing the angle of the ribs, basically narrowing the ribs inward like this, I could create that curved waist shape. As I thought about it, I said, why not? Because we all know how to narrow that area. The internal organs in the abdomen just float around in a kind of squishy, fatty tissue. And they find a place for themselves. Even if I narrow that area, it wouldn't harm the internal organs. And on the other hand, the protective function would still continue. So I thought, this is what I need to do to satisfy them. I thought, let me make a small incision, crack the ribs, break them, and then screw them back together. But then I thought, since we're doing something aesthetic, can't I do it without making any incision at all? That's what I started to think, and we developed some technologies by adapting suitable medical device equipment to this system. Now, with the help of ultrasound, I can intervene there without making any incision, just by entering with a needle tip, and I can change the shape of the rib. That's how I established this rib shaping procedure. I named her Ribella. Why Ribella? Ribella, beautiful. It means beautiful ribs, and I think it's a very nice name. Then we tried it first in lamb cages and it worked. Then we started treating our first patients. We have been doing this for a year. So far we haven't encountered any complications. I can say our satisfaction rate is 100%. There are no scars, no incisions, no stitches. At first it was painful, but then drawing from my experience with pectus surgeries, since as you know, pectus surgeries are painful procedures, and to relieve this pain, there's a cryotherapy method that's been emphasized at congresses. So I said, wait a minute. I realized I could adapt cryotherapy here as well, and by incorporating cryotherapy into the Ribella procedure, I was able to eliminate the pain. I shared this the other day. By the 30th minute of the surgery, the patient came out with almost zero pain, and on the first day, we went out to dinner with our patient. He had no pain at all. He returned to his country very happily. With the advancement of cryotherapy, we have perfected the Ribella procedure. So how do we optimize the shape we give to the patient's waist? This is also an important topic. We determine the patient's waist curve as follows. When the patient arrives, we scan their body with a 3D scanner like this. In other words, we create a model that could produce a statue of them, just like this sculpture, and could even print it with a 3D printer. Then using special software, we adjust that shape to narrow the waist, and we have the patient watch this image through a virtual reality headset. Here in the middle of the room, the patient sees themselves both in their old and new forms and likes what they see. Let's say they might say something like this to us. I want the top to be a bit narrower, the bottom a bit wider, and the middle to look like this. We reach a consensus that meets their requests and find a middle ground, and as soon as we both agree, we immediately start producing a corset using our 3D printer. After producing the corset, we immediately put it on the patient following the procedure. We ask them to wear this corset for about 20 hours a day for 2 months. Moreover, the corset is not hard, difficult, or uncomfortable to wear. Let me show you, it's actually very soft, almost like a textile corset. And as you saw on our patient, on the first day after surgery, even though the patient is wearing the corset under a very thin dress, it's a corset that doesn't reveal itself at all. Our patient can use this corset without it interfering with their social life. And at the same time, it helps to slim the waist. They continue to wear it around the waist for 2 months, and the corset gives the waist a nice curve. At the end of 2 months, the waist takes on the shape of the corset, and since we've intervened in the bone tissue, there's no possibility of it returning to its original state. Let's say the patient continues to eat afterwards. They gained a lot of fat, they gained weight. Since the skeletal system has been shaped accordingly, even if they continue to gain weight, that curvy contoured waist will remain, and the patient will be able to continue living with a slim curvy figure. The other day, patients who had both liposuction and the waist narrowing Ribella procedure described liposuction as a much more difficult procedure compared to this. I haven't had it myself, but I know a fair bit about it. The Ribella procedure is very simple. There is no pain issue, no incisions, no scars, no stitches, no dressings. We can even go out to dinner with our patient on the very first evening after the surgery. So the Ribella procedure was born in this environment, developed this way, and now we've reached a year of experience with it. Our goal is to promote this to the whole world within the scope of health tourism, and in the future, perhaps after some time, to train new doctors in this field. I receive a lot of feedback on this subject. Young doctors want to choose the thoracic surgery department. I believe I have contributed to my department in this regard, and I am proud of it. Thank you all for your interest. With love,